This is MacVoices TV. This edition of MacVoices TV is brought to you by Rogue Amoeba, makers of fine audio software such as Airfoil. With Airfoil, you can send audio all around your house. That's Airfoil by Rogue Amoeba at rogueamoeba.com. Hi, I'm Chuck Joyner, and this is MacVoices TV in San Francisco at Macworld 2011. We are in the MacPractice booth, again, talking to Mark Hollis, a visit we make every year, Mark. It's always one I look forward to.
It's one I look forward to as well, Chuck.
This year, MacPractice has some, I think, important news for the medical community, something that apparently is unique, and I'm not as well versed in it as you are, so I'll let you take it.
Well, the big thing that everybody's discussing, and particularly this week, just a few days ago, with the Obama State of the Union address, is the healthcare initiative. And a big part of the healthcare initiative is the HITECH Act, which provides money that is incentives for physicians to adopt electronic medical records. And in order to qualify for the money, the doctors must demonstrate meaningful use, which is clearly defined very specifically in the Act, of a certified product. And MacPractice is the only product, the first and only product on the Macintosh, native to Mac OS X, that is certified. We made the public announcement on Monday. So it's ONC, that's the Office of the National Coordinator, ATCB 2011-2012 certified. And then there's a lot of other things that everybody should read that are on our site at MacPractice.com that describe all of what that means.
Now, this is not a small amount of money we're talking about.
No, we're talking about $44,000 paid out 5 out of 6 years to physicians as a maximum to I shouldn't say just physicians, because it's not. It's doctors. Theoretically, it could be dentists, chiropractors, physicians, doctors in many different specialties who can fulfill that definition, can attest to the definition of meaningful use. And I'm sorry, and about $64,000 or $65,000 for Medicaid as well.
Okay, so that's a lot of money on the line here, and you and I have spent the last couple of years talking about electronic medical records and a lot of issues. So this says to me that you all were watching carefully, you were seeing what needed to be done, and were preparing the software for it, so that if and when it came, you could address it, which you obviously have. Yes,
this has been the longest time that we've had in between updates, 3.7 and 4.1, which is what we're showing here at the show. This is the longest gap of time that we've had in between updates. So this is a major update for us. We have a lot of things in it that are in addition to, unrelated to the certification, which we'll be announcing next week. But we don't want to muddle the announcement. So we're just talking about the certification right now. But we have been preparing for this. We've been watching what's been happening. We've been guessing and projecting what we think would be required in the certification, but the certification standards were only actually finalized in October. So at the final certification standards, after they amended them and changed them and amended them and changed them and took things and added and so forth, we then did all that within just the last few months and got the certification.
Without taking us too far into medical administrative minutia, how does MacPractice address this? How does it help document to the government? Because obviously they don't just send a receipt in saying, hey, I'm running MacPractice.
Right. One of the requirements of all of the certified products is they will produce a report that will give the government the information necessary in order to verify that that physician or that provider has used the software in a meaningful way. And so that's built into the product. So everybody's product that is certified has done that.
Mark, I would think that this is going to cause some physicians or some practitioners to take another look at MacPractice. Maybe they have something they've been using, they couldn't justify the expense or the hassle associated with transition. How easy do you all make it for a provider to move from an existing system over to yours?
If somebody's using from a practice management software, now remember, we don't know exactly what the numbers are now, but let's say that there's somewhere around 85-90% of physicians, small doctor practices, do not have electronic medical records. So they're going to electronic medical records for the first time. So what we would be transferring is their demographic information. And we've been doing that right now. Right now, we We transfer, let's say we had 600 new system sales over the course of last year, and I would say 550 of them were going from one system to our system. So we're very familiar with that. We have a data conversion department, and we've a lot of experience in transferring data. Over the period of, really, we have about 30 years of experience of doing that. In terms of going from one EMR to another EMR, it's a little more complex, but there are some methods of doing that. There's a third party, for example, that will take the data that's in a current EMR, and they will then host it so that it can be referenced when necessary. But once again, that's a smaller percentage of the customers that are coming over. But there are definitely customers that are not happy with what they have. They're not happy with how much they're paying. They're not happy with the difficulty of the PC systems. There's a lot of failed implementation that have occurred in EMRs over the years. And that's one of the bad raps that EMRs have gotten.
Is that something that you do as a value-added service? Is it just part of the package of buying and converting over to MacPractice? Or is it something that providers would, practitioners, I keep using the wrong phrase, would be best going out and finding a third-party service to help them make that move over?
No. When a customer comes to us, we're going to help them do every part of what it is. There may be a cost associated with it depending upon, but if there's a third party that's involved, generally it's a third party that we have a relationship with because we need everything to work for the doctor. And that's why we provide on-site training, we provide on-site service as necessary, we provide remote, we have 70 corporate employees in Lincoln, Nebraska that do support and development. So we have developed all the resources that are necessary in order to support the doctor as they transition over to just even our practice management or to our practice management with EMR.
That's great. So this is a solution that can actually make them money depending on what they're using, or will certainly help ease the transition over, and for the future just put them in a better position to take advantage of whatever's out there.
Right. Ideally, I like to hear that a doctor wants to purchase EMR not in order to get $44,000. I like to hear a doctor wants to purchase EMR because the doctor is interested in becoming more effective, more efficient, enhancing the inter-office communication, enhancing communication with other physicians, lowering his cost in terms of staffing, and producing better patient care. That's really the intention of our software. And in a sense, we've sidetracked in order to also meet the objectives of the Office of the National Coordinator. But that's the goal of us, that we have as developers, and we continuously work toward that. So even if the money drops out, and there is a possibility, by the way, right? I read this morning that the HITECH Act and the money is actually at some risk. The GOP has introduced some legislation that could possibly even eliminate that money. Now, I don't know who knows what will happen. But we've developed a software that people have purchased prior to there being any money because of the fact that there was a benefit. And our software is optional, by the way. So we have doctors that still buy our software for practice management, and they don't necessarily do electronic medical records. As I explained to you earlier, most doctors don't do electronic medical records, and every doctor is not going to be doing electronic medical records 6 months from now. It's going to take quite a few years before everybody's doing it. So our primary customer is the doctor. And we're also now, in a sense, the government's also becoming our customer for those people that choose to use it to attest to meaningful use.
Mark, something we've talked about now, I guess, a couple times, and last year we really got into it. The iPad at that point had been announced. We were all looking for it. We all had a lot of fantasies about what it was going to be. Now, we're a year later. It's only been in the market since April of 2010, and yet it seems to have taken over so many things, including the medical world. There's been so much there. And I know even back then, you all were doing things to help doctors use their iPhones to access information, to manage information. Now you have the iPad to work with. And before we started shooting, we were having a discussion about the MacBook Air as well. So give us an update on from a MacPractice perspective specifically, and medically in general, where the software is, where the medical profession is with adopting some of the iDevices and managing information a bit more on the go.
I think the key answer to your question is that there is not one solution that is appropriate for every user and for every purpose. We have iPad solutions right now that are available. So we introduced the MacPractice iPad interface, and we were able to take advantage of the screen size and use primarily what we had in the iPhone interface and enhance it. We were able to add, so if you can take a shot here, so you can actually see a calendar that actually looks like a calendar, which obviously you couldn't do on an iPhone. Over here you see a calendar on the iPhone, and you're just talking about a list of appointments. In addition to being able to do that, you're also able to actually electronically prescribe. I believe at this time we're the only product on the iPad on which a doctor can e-prescribe, which is a part of fulfilling meaningful use. But the important thing is that data, when the prescription is done for a patient, it's automatically updated in MacPractice and the patient's record. So the integration is important. Now, the doctor is able to do things like, for example, if they're doing hospital rounds, they can indicate that they've done a particular procedure for this particular patient and automatically send it to the front desk. They don't have to bring it back a day or two later when they come back in. They can communicate with reminders back and forth. And the iPad size of the screen for that makes it much more functional than the iPhone, although you can do all those things from the iPhone as well. So you could do either one. We also have a VNC connection, and we've provided guidance to our customers as to how to use VNC to be able to connect to MacPractice on a desktop and be able to do everything they can in MacPractice from the iPhone and the iPad, but primarily the iPad. So the VNC connection allows them to be able to do that. They can even have multiple iPads connected to one computer using Mac OS X server and using Aqua Connect, so they have different terminal sessions running on that single computer. Now for some people, some doctors will pull up that VNC and they say, I can't do this, it doesn't work. But another doctor in another practice will say, that's the best thing since sliced bread. That's wonderful. That's everything I've always wanted. Which is why I say what's appropriate for one is not necessarily appropriate for another.
Well, just like everywhere else in the industry, I mean, there are certain age groups that, I mean, let's face it, the younger physicians, the younger practitioners are much more apt to adopt this. The older people who have done it their way for 20 years, maybe not so much.
Well, I think that's a part of it, but I also think there are some other issues related to the iPad versus the Mac OS X desktop. And when I think that the iPad is a great solution, for example, for a dentist that wants to show you your X-ray, and they would like to actually hand it to you to look at instead of having you look at a screen that maybe is 10 feet away from you. And then so there's something about you're owning it when it's sitting in front of you, and then they zoom it so that you can actually see the crack that they're talking to you about. Same thing with a pediatrician, with an orthopedic surgeon, for example, that's showing you a fracture. So I think for viewing media, and that's what Steve Jobs talks about. He talks about as a media viewer. So in terms of viewing media, it's wonderful. In terms of presenting educational information, it's wonderful. It's not necessarily so great, the iPad, as a data entry device, however. Unless you happen to be a practitioner that has a very simple checkbox kind of a form. But if you're entering a lot of text and typing, it's not really great. You can't see, if you want to view a lot of information at one time, obviously it's a small format. You're not going to be able to see it as easily as you could on a 24-inch or 27-inch monitor. The interesting thing is, if you look at the history of computers and you look at what's happening right now, Apple sells an iPad. What's the smallest Apple monitor that Apple now sells? It's 24 inches. It keeps on going up. So here we have, everything's gone down to a 5x7, and on the other side, we've got things don't even go any lower than 24 inches screen size. So we've got huge differences, and it's very hard to differentiate what's important. But I think what is really significant is the introduction of the MacBook Air, and I don't think it should be overlooked by doctors. It's very powerful because of the size, because of the angle of the screen, the fact that it does not, as we're talking, does not really stand between you and me as I work with it. It's like a chart. I can hold it in a hand. It's very light. I have full functioning keyboard. I have the ability to be able to look at a much larger screen and see all the patient's information. I can do everything I can do with any desktop application on this. I can go to the internet. Of course, I can do multitasking. I can use Word. I can use Excel. I can use all the programs that I'm familiar with on the desktop. I can use every aspect of MacPractice. And I can connect, if I'm a dentist, for example, I can connect a digital sensor to this computer and actually capture digital x-rays right into this computer that will be then in my patient's record in MacPractice. So I have incredible flexibility here, and it's in this portable format. The other thing I have is that when I don't have to put my hand on the screen in order to be able to enter data, which covers up my patient's data. I can look at my patient's data while I'm entering information. So I think that this is a tool. I encourage doctors when they're considering that they're going to use something in the room, because Apple's done such an incredible marketing job with the iPad, they immediately think they should use an iPad. I suggest to them that they strongly take a look at the MacBook Air before deciding that the iPad's the proper device. We do plan, by the way, to do additional development on the iPad, native applications for the iPad. But I'll still be saying the same thing. I'll be saying we have a great iPad application, but I'll be saying I still strongly suggest that you take a look at this and make the right decision for you as a user in your practice.
It's an interesting perspective, and especially, we talk about it from a consumer perspective. We talk about it from a business perspective. The medical professional has certain specific needs. You address them. We don't think about them until you point them out, and it's like, yeah, that's a great point. The ability to capture data in, the ability to not cover up things, the ability on the iPad, in the case of the iPad, or in this, to be able to turn it around and show it to a patient, and have them take ownership almost of the unfortunate situation they're probably facing, whatever it is. So yeah, a lot of different dynamics here. You obviously have spent a lot of time thinking about it.
I've been doing this for about 30 years, and I started working, when I started, I was representing the software that my partner, Patrick Klein, developed, MediMac, DentalMac, and ChiroMac, and I worked myself personally training, installing, and consulting with 650 offices in the New York metropolitan area. And now, as a company, we work with 3,500 offices in 24,000 users. And on a daily basis, I'm reading their emails and I'm listening to information, but I also have the firsthand experience of being in their offices. So yes, I've spent a lot of time and research and thought.
You want to turn around so we can see your scars? Mark, it's always a pleasure. Thanks for taking the time. For the viewers who are not here and get to talk to you directly, what's the best website or what's the best way to find out everything they need to know about MacPractice, the certification enhancements and all?
Right, MacPractice.com. Everything's on MacPractice.com. I would encourage anyone that's interested in learning about MacPractice to register at MacPractice.com, to get on my email list, and you'll get correspondence from me about news about the industry, news about what's happening with MacPractice, news about events, places that they can come and see a MacPractice presentation, trade shows that we attend. We have a long list of trade shows that we're at. Once again, we have MacPractice MD, MacPractice DDS, MacPractice DC, and MacPractice 2020. We've tremendous advancements, particularly in dentistry, and this year we have tremendous plans for eye care professionals. So, and I haven't really talked about that in this conversation, but that's not to say that there isn't a lot that we could talk about in regard to that.
Hey, that's great. Well, we will get you back on. But I tell you, it's always great to see you here. Thanks for supporting Macworld. We'll see you back here in 2012.
Thanks, Chuck. I look forward to it.
Folks, I'm Chuck Joyner. This is MacVoices TV at Macworld 2011 in San Francisco. We will be back soon. Thanks for watching.
MacVoices TV is part of the MacVoices Group and a member of Mac Level 10.